Good. All right, go ahead and get started. Good afternoon. I'll start with a few opening remarks, and I'm going to turn it over to some fine guests over here for some comments, and then we'll open it up to questions at the end. As most of you know, MMSC has applied for a certificate of need in the state of Iowa for a linear accelerator to expand on the cancer services that we currently provide for Marshalltown. I say we, I mean McFarland Clinic. They've been providing medical oncology here for 25 years. The community support for our application was outstanding. We were hoping for 1,000 letters of support and received over 1,200 letters. And today we're pleased to announce that MMSC and McFarland Clinic have reached an agreement to expand on those cancer services, provide radiation therapy services here. We'll be the sole owner of the center, and McFarland Clinic, their radiation oncologists, will partner with us to provide physician services. The date for our CON hearing, originally scheduled for October 21st, has been moved to November 3rd. Their schedule was too full to do everybody on that day. So November 3rd, we'll go and testify before the Health Facilities Council, make our case for our certificate of need. If they approve that, we'll do groundbreaking next spring and hopefully complete that in the summer of 2016. Now I'd like to introduce Dr. Shane Hopkins. Dr. Hopkins is a radiation oncologist at McFarland Clinic. Dr. Hopkins. Thank you.
So I wanted to just introduce you to radiation oncology as a general discipline. It is the branch of medicine that is interested in treating cancer with ionizing radiation. So in order to do that, it requires either radioactive isotopes or a linear accelerator that can artificially produce radiation to treat patients. So as previously mentioned, a linear accelerator is, the certificate of need is a very expensive, multi-million-dollar piece of equipment. It accelerates electrons close to the speed of light, maybe 2/3 the speed of light, something like that, smash into a target and create high-energy X-rays that then are shaped and directed towards a cancer tumor very precisely in order to treat cancer, and some non-cancer diseases as well. And so the radiobiology of the way radiation works requires that patients come back frequently for visits. It can't all be done in a single session unless there's not a risk for damage of normal tissues. And since there usually is a risk, it needs to be daily treatments over the course of typically several weeks. And so, for example, a prostate cancer patient may require 45 visits to come in for daily treatments Monday through Friday. And we're currently treating many patients from Marshalltown, have a large number of patients, but they put in probably upwards close to 100 hours of driving during that course of treatment, which is a big burden on everyone. It also can be a big problem in the winter months, and just in terms of convenience, it's suboptimal. Because it's an expensive piece of equipment, sometimes that's just necessary, but it'll be a wonderful advantage, a wonderful benefit to the community if we can have local equipment and the ability to treat patients closer to their home for their convenience. The visits themselves are only about 10 or 15 minutes. They're not long. Most cancer patients do require radiation at some point during their disease course. About 60% of cancer patients will receive radiation. I think that is the gist of what I wanted to say, and I'll just save the rest for questions. Did I miss anything on your topics there?
No, you're good.
Okay.
Thank you very much.
We're back over there.
I'd like to introduce Lynn Lanning. Lynn is the Director of Medical Oncology Services in McFarland. Lynn, come on up.
Good afternoon. As John said, we have been providing medical oncology services here in the Marshalltown community for the last 25 years, and I've been fortunate to be part of that for the last 25 years as well, in coming over and assisting our medical oncologists in providing care here. We have 2 medical oncologists currently that are providing care here 3 days a week. Dr. Joseph Merchant on Mondays, and then Dr. Deborah Crow on Tuesdays and Thursdays. The services that we provide here is consultation with patients newly diagnosed with cancers and hematological malignancies, And then they oversee the treatments, which you know as chemotherapy or biologic therapy. We also do consultations in regards to cancer risk and then the genetic risks for cancer that an individual may have based on their family history. We also do provide other infusional services as well. We currently have 7 infusion chairs that keep very busy. We see up to between 75 to 80 patients per week by the medical oncologists and also the specially trained nurses that administer infusional therapy as well. So we remain very, very committed to continue to provide medical oncology services should a new facility be built, and are excited about that opportunity of expanding the services here and making things accessible. Many of our patients have multi-modality therapy, meaning that they have chemotherapy and radiation therapy combined in their treatment course. This allows us that very important collaborative and coordinated care should radiation oncology be here in Marshalltown for the patients to be able to easily get chemotherapy and radiation therapy on the same day. Now if a patient needs it, we have to coordinate the timing so that they can drive back and forth to Ames and still get infusional therapy either here or in Ames. So this will really be a big time saver and allow us to more collaborate more closely with coordinating that care. So that's medical oncology and what we're offering now and hope to in the future.
All right, thank you very much, Lynn. And last but certainly not least, I'd like to introduce Dr. Steve Van Buren. Steve Van Buren wears 2 hats. He's a general surgeon with McFarland Clinic here in Marshalltown, and he is also a MMSC board member. Dr. Van Buren.
Hello. I'm also the chief of surgery, if you will, for our MMSC hospital as well, so I have that hat. I'm here just to, again, reinforce what Lynn just said. Medical oncology has been here for 25 years. The surgeons have also been here for 25, if not, well, forever. We've been delivering surgical care to cancer patients, treating cancer surgically. We've been doing that, and we will continue to do that, regardless of how the ceiling turns out. That's just something for the public to know. But to have radiation oncology on board, to get a cancer center in town, would just be a great complement to the cancer care that we've always been giving. It will allow the full complement of cancer. Many of the patients that I treat for cancer do require radiation. That number 60%, that's a good one to hear. I didn't realize that. Many of these patients, we have to coordinate the cancer care. They have to leave town to get their care, but to have it here in town would be a great thing, great for the patients, and allow us to provide their care totally in town. Coordination of care was brought up, and I just want to reiterate that we have been, that is our mission here at McFarland Clinic, to have coordinated care, but we've been doing that as a medical community in town here for quite some time. Dr. Hopkins is my partner. We've been working together for a long time. Dr. Pro, Dr. Merchant are my partner, not only in the clinic, but in the medical community as well. We've been coordinating care, and to have everybody in one location would just be beneficial to that patient. We've done, as far as the hospital and the clinic working together, we've been doing that forever. We're working in conjunction with the hospital, with the cancer center now, plus we do a tumor board, which is a multidisciplinary cancer conference that involves the surgeons, the medical oncologists, the radiation oncologists, the pathologists, the radiologists. But we've been doing that coordinated care here in town, and to have, again, the radiation oncologist present would be great. And that has also allowed Dr. McKinnon, who is employed by the hospital, to continue to deliver care in a coordinated fashion as well. We all do work together as a medical community here, and I think that's good to know.
Absolutely. I would just open up the floor for questions for any one of our panelists. If anybody has any questions that they'd like to ask before we move on here.
Would the McFarland staff then go from this site to the hospital site back and forth, or would it just be at the hospital site, or?
Yeah, let me introduce Jody.
Yeah.
You know Jody.
Yeah.
So she can answer that question.
The changes that you're talking about would be for medical oncology. And at this point in time, with the campus moving, we are considering moving with the hospital as well. So we would hope that everybody would be able to move at the same time, and staff would already be on site down the road at this time. I don't think the cancer center is scheduled to open until 2016, should it be approved. So by that time, we could already potentially be on the same campus.
Jody, could you or John reiterate something you alluded to today? This is not the first time that the two have partnered up on various projects, correct?
That is correct. We partner on many things. You see some things on a daily basis, like Dr. Van Buren being on the board, and we have other physicians on the board. There are other projects that we work on together. The hospitalist program is a program that's at MMSC, but we work very closely together on that to ensure that it's success, things like that. And that's what comes to mind right now. We work together to make sure that their current EMR implementation goes well, and our physicians are involved in that process, helping them meet meaningful use thresholds, things like that. It's top to bottom.
Yeah, I think the relationship's been very strong for a long time. And, you know, Jody and I actually meet every other week to talk about how we can work together more appropriately, even from an administrative level, to make sure that the day-to-day stuff tends to go well. So if you don't hear much about that, it means it's probably going pretty well.
But this, if it gets approved, that would be like the crowning jewel of cooperation between you two, correct?
It would certainly be a lot of fun.
Yeah.
How's construction going?
Construction on the new campus?
Yes, sir.
It's going well. We're making great progress now that it's dried out a little bit. As you know, we got off to an interesting start with the rain just about every day for the first 4 weeks. So we're on schedule for next summer, and as we get closer, we'll be able to define that date a little bit better.
To create this partnership and all the work that goes into it, does that mean you're kind of optimistic about what will happen with the certificate of need, or what is that?
Well, we love to be optimistic,
Yeah.
but like any jury, if you will, we never know what the outcome is going to be. But the application is very strong. The relationship with McFarland obviously is an important part of that application. It gives us an excellent coordination to demonstrate to the council that we've got our ducks in a row should they approve it.
Jody, I'm sorry, did McFarland send letters or a letter of support to this facilities council? We heard all about how the public has done a good job in the letters. Did McFarland kind of do the same thing, write a letter of recommendation, so to say?
We'll have a letter of support with their application, and we'll also be attending the hearing in case there's any questions from us.
And several of the physicians have written letters as well.
John, would we know on the night of November 3rd the outcome, or is it something that, you know, might take a little while for them to process it? Or
No, they'll make the decision that day. The application's already been submitted. The day of the hearing is actually verbal testimony. It'll give them an opportunity as a council, the 5-member council, to ask us questions, and then once that's complete, they'll vote. And it's a majority vote, so we'll know if we have 3 or not.
How many on the council can you say?
It's 5 council members.
Okay.
Yeah.
If that didn't go through, is there any kind of things you guys can work on to try to bridge the gap in those services without this certificate, or, you know?
Well, and I think most of these guys did a great job of talking about how well the coordination happens now. So that level of coordination will continue. We'll always be looking for an opportunity to improve the service. So it would be one more piece that would help make all that happen. But certainly Cancer Care is delivered very well now, and I think it's important that people know that.
I mean, I do think, just to interject, that if the certificate need does not go forward and get approved, I think we need to assess, you know, hardships patient might be experiencing in that travel back and forth, and how we can maybe assist patients in alleviating that hardship, and that would be something that I would like us to see. But,
I can speak to that hardship because I'm a cancer survivor, and unlike the 45 that Dr. Hopkins alluded to, I had 25 trips to Ames and then stay in the hospital for some very high dose focus therapy. But my 25 trips made 2,000 miles, and the coldest I saw it on the thermometer on my truck was -22 on New Year's Eve morning. So that was chilly at 6 in the morning to go over there for radiation.
And sir, also what they talked about, this is interesting too, the treatment, the drive over takes longer than the treatment itself.
Oh my, yes. 10 or 15 minutes there and 45 minutes each way.
This is Dr. Thomas. Yeah, Greg Thomas. McFarland Family Medicine.
I think that's one of the most important things to consider out of all of this is with the benefit that's added for the patient and the patient's family and support system. If they can get this care close to home, that's 2 hours a day that their family doesn't have to take off of work to be with them and go to the treatments and deal with all of the stuff around it. It's much easier and much more healthy to stay closer to home when you can.
I think every day I was sitting in the waiting room waiting my turn, I saw Marshalltown people there. Visited with them sometimes they were my patients. Most of them, unfortunately for them, were more frail than I took myself every day, but most people had family take them.
Yeah,
I've never been called frail.
You know, and on that end, in the 1,200 letters that we received, it does not take you very long when you read those letters just to feel the emotional impact. I mean, the stories just come through. And we plan to, you know, the council has those letters. That's part of our application. They'll read those letters, and we'll also have some personal testimony that people will actually tell their story. And, you know, it's hard to get around the emotion that people can convey in their words about their cancer treatment.
I had a hypothetical question. It's one of my favorite questions. If you guys get permission to build, and if this facility opened tomorrow, could you guys pull it off with the staff that you have? Do we have to add on? Or if this facility opened tomorrow, could we start with the current staffs that we have? Hypothetical.
The answer is no. You couldn't start tomorrow because there are specialized people that you need to recruit and train and hire. Because radiation therapy requires dosimetry staff, radiation therapy staff. We'd certainly have the physician staff, but then coordinating the physics work, all of that, certainly within a year, could easily be done. But no, we wouldn't be able to do it tomorrow.
John, what are some of the criteria that the council is looking at in making a decision about whether or not it would be approved? Has that been reviewed perhaps with the media in previous, or?
Well, you know, they look at the things like, you know, how many patients do you serve, that kind of thing. How far do they have to go for treatment now? What would be the impact on other providers of service? That's one of the things that they want to take into consideration. The communities that provide that service now, Ames, Des Moines, Iowa City, Waterloo, that surround us, Cedar Rapids, they all have an opportunity to know that we're applying. They get a letter that says, Marshalltown is going to apply for a linear accelerator. What are your thoughts on that? I'm paraphrasing. But then they have an opportunity to either say nothing, oppose it, or support it. And so, depending on that kind of feedback, then the council obviously takes that into consideration. Community support letters, fundraising. Does the community support it not only with their letters, but with their financial commitment? Those have an impact.
With McFarland being based in Ames, it's obvious that McFarland part of this, then Ames office is on board with this as well, even though there'll be competition, I guess.
Yeah, I'll let Jody address that.
Yeah, McFarland Clinic, we are a network, we cover central Iowa, but when McFarland Clinic supports us, we are supporting this as an organization. Our physicians are behind this 100%.